the end of the day, we have two missions here. Number one, protect the team, protect our force, be ready to flux. We don't know what else is bad going to come down the road, and this mission is long from over, so we got to be able to make sure that we're boots on the ground, but we're also doing this in a safe, smart manner. And then number two, it's all about beds in the ground. The number today is 9,693 beds that we are creating for mayors and governors.
We now want to bring in the man spearheading the effort to build these sites all across the country.
Turning the Javits Center into a temporary hospital.
We have a whole part of our organization that is designed to be able to take care of disaster. 9/11 was probably one of the best examples where within 12 hours, it was our guys on the ground that were actually shuttling people back and forth.
3 exhibition rooms at McCormick Place will have 3,000 hospital beds in them.
Based on our conversations today with the Corps, we got a sense for the kind of work that they can do here in the Commonwealth.
A state cannot build hospitals in this period of time. We can use the Army Corps of Engineers to come in.
We are cleared hot to be able to go into these kind of missions. Once FEMA turns us on, we say, then we go ahead and do it. As you know, this all started about 2 weeks ago when Governor Cuomo asked President Trump to say, I need help with the Corps of Engineers. We flew to New York within about 12 hours, and we devised a very, very simple plan of basically making COVID facilities and non-COVID facilities. Go ahead, General. If you aren't aggressive enough, coming up with a solution before it's asked and pushing the decision maker to think through the options before they're needed, then you're going to be behind the need. And I hate to say it, but most leaders will wait till the very, very last minute, till they have all the available information, and then they'll make a decision at the very, very end. Don't wait for the phone to ring. Anticipate the requirement, be ahead of it. I've got my colonels walking into the governor's office and the mayor's office saying, we see that you might have a potential challenge here. Can we help give you all the information needed so you can make a timely decision? Where's the gaps? Make sure that there's not a significant gap out there, that it is at least a conscious decision that's being made by a mayor or governor.
We know that coronavirus patients are now being taken to this location where we are, the field hospital at the Javits Center.
The first couple, which was really the Javits Center and a couple others, really did start out non-COVID. I just got back last night from Chicago and Detroit. They went in a little bit more worst case. They went in COVID from the very beginning. There are the sites, there are the supplies, and there's the staff. All three are critical. What we don't want to do is to ever have it that the sites are the critical path. There's none of this that is really, really hard from an engineering perspective. We're not doing rocket science here. This is to take an existing building and modify it with things we're bringing in, most of which are relatively straightforward. Our job is to blow through the red tape and to be able to make sure we're challenging those that put obstacles in our way, and to be able to make sure at the end of the day, beds in the ground.